Mandated to be the policy-making and strategy formulating body on drug prevention and control, the Dangerous Drugs Board led the development of the Philippine Anti-Illegal Drug Strategy or PADS. The Philippine Anti-Illegal Drug Strategy is a framework that prescribes how the government and all sectors should work together in cutting the supply and demand for illegal drugs. Two components comprise the Philippine Anti-Illegal Drug Strategy: drug supply reduction and drug demand reduction. On demand reduction, we want to ensure that communities have access to appropriate and responsive community-based interventions and aftercare programs, strengthen capacity of policymakers and preventive education practitioners, and provide access to various drug prevention services and programs in workplace and institutions of learning. Four cross-cutting priority areas have also been identified, which include empowering LGUs through capacity-building programs, conducting intensive and sustained advocacy campaigns, providing adequate and sustainable support to partners in the implementation of alternative development programs, and maximizing reporting platform in relation to monitoring and evaluation. On supply reduction, we are prioritizing efforts to sustain cooperation with regional and international counterparts, intensify interdiction and village drug clearing operations, strengthen the criminal justice system and policies against drug smuggling. These efforts are expected to result in legislations, policies and programs that are informed by evidence and best practices of partners, LGUs, and communities, becoming more vigilant in reporting drug offenses, increase in prosecution and conviction of drug offenders, and improvement in seizures and interdiction in seaports and airports. By 2022, PADS envisions to have attained drug-free communities with institutionalized anti-drug policies, systems, and processes. To attain this, President Duterte signed Executive Order No. 66, Series of 2018, last October 29, 2018, directing all government offices, departments, bureaus, agencies, including government-owned and controlled corporations, and state universities and colleges to institutionalize the Philippine Anti-Illegal Drug Strategy in accordance with the respective agency mandates. 61 agencies have specific roles and responsibilities under the Philippine Anti-Illegal Drug Strategy. Of these 61 implementing agencies, 41 are members of the ICAD or the Interagency Committee Against Illegal Drugs. ICAD was formed to establish a coordinated and integrated mechanism in implementing the Philippine Anti-Illegal Drug Strategy. Executive Order No. 66 mandates the submission of implementation and operational plans by all government agencies. To help fine-tune these plans, the DDB organized workshops for focal persons of all concerned government offices and agencies. All the task agencies have now finalized their respective agency action plans for the Philippine Anti-Illegal Drug Strategy. DDB also conducted orientation workshops on the implementation of the PADS for ICAD members and officers. Discussions during the workshop focused on addressing the complexities of the drug problem, promoting greater community participation in the prevention of drug abuse and trafficking, and providing direction on actions to be undertaken in line with PADS, such as the implementation of the drug-free workplace policy. To level off the understanding and ensure the commitment of local officials in the implementation of PADS, a module on the localization of the PADS for local government units was developed in cooperation with the Local Government Academy and integrated in the orientation course for elected officials. Through the National Communications Plan for PADS, agency-level messages and identification of communication strategies focus on the youth, families, and other target sectors and stakeholders are in the process of development. The communications plan will allow target stakeholders to be the duty bearers of PADS, the principal players in keeping communities safe, peaceful, healthy, and drug-free. Executive Order Number 66 also mandates the development of performance standards to ensure compliance of concerned agencies with the Philippine Anti-Illegal Drug Strategy. In line with this, the Dangerous Drugs Board convened implementing agencies to finalize indicators to determine the success of PADS. The DDB also initiated the development of an online reporting system called PADS ARMS, or PADS Agency Reporting and Monitoring System. In the span of 1 year, after the PADS has been institutionalized, the Dangerous Drugs Board were able to set the foundation for its effective implementation. In support of the Philippine Anti-Illegal Drug Strategy, the Dangerous Drugs Board also successfully initiated the following drug prevention, capacity building, and advocacy programs. Campus Tour for Kids. Training of trainers on life skills enhancement on drug abuse prevention. Training on screening, brief intervention, referral to treatment and assessment of drug dependency among local government physicians from the municipalities of Bohol and Cebu. Training on the Universal Prevention Curriculum for Substance Use. Orientation Seminar on Community-Based Intervention Program for Faith-Based Organizations focusing on Upland Sagip. Drug Abuse Prevention Program for Senior Citizens. Capacity Enhancement on Drug Abuse Prevention for the Corrections Pillar. Drug Abuse Prevention Program for Transport Groups. Barkada Contra Droga. Training of Supervisors on Family Development Session and Module on Drug Abuse Prevention and Systematic Training for Effective Parenting. Seminar Workshop on the Dangerous Drugs Law for Judges, prosecutors, and law enforcers. As of September 2019, the Dangerous Drugs Board was able to issue 789 regulations and resolutions, implement 28 anti-drug abuse advocacy programs, and train 5,015 individuals. As we continue to further the whole-of-nation approach in addressing the country's problem on illegal drugs, we call on every Filipinos to commit to actively participate in drug prevention and control initiatives. With our collective actions anchored on the rule of law, respect for human rights, and promotion of public health and safety, we will continue to pave the way towards drug-free communities by 2022.